Things to remember at the evaluation station. Ensure that you always communicate the patient's demographic details, including name, date of birth, and hospital number at the beginning of your SBAR update. Within the background update, the date of submission should be provided in the patient summary. The patient's reason for initial admission and diagnosis should be taken from the patient's summary. However, remember that you may have gained additional information as part of your stations that provided you with further information about the diagnosis. For example, the patient summary may state reason for admission, elective admission investigations, diagnosis or operation, esophageal reflux and investigations. However, the OSCE scenario may tell you that the patient has been diagnosed with a peptic ulcer. In this case, you would state the reason for admission as peptic ulcer, rather than esophageal reflux or investigations. When you outline the nursing care provided to meet the identified needs, again, these should be taken directly from the nursing interventions provided in your care plan and referred to in the past tense. For example, we administered bronchodilators and respiratory medications to Susie as prescribed. Remember not to use acronyms such as NBM for nil by mouth, and try to speak in full sentences rather than note form. Just stating bronchodilators given would not be appropriate. Add any relevant information that was gathered as part of your treatment process. For example, if the patient revealed in the assessment station that they had an allergy to penicillin, even though it wasn't specified on their patient overview, this information should be included, along with the patient's reaction to the allergy, for example, rash. If you have identified any referrals that the patient needs, such as to a quit smoking service or for a review by a physiotherapist or review by the diabetes team, this should be specified within the areas identified for health education within your assessment update. When making a referral, you should clearly specify the risk associated with the person's condition. For example, patient is at risk of falls due to increased mobility. Need OT to assess accommodation as has 3 flights of stairs. If you are short on time, remember to prioritise the most important and relevant updates pertaining to the patient. The date and time of transfer should be the time mentioned in your OSCE scenario.